Hello, this is Dr. Alexander. I'm going to be discussing your Chapter 24, Pharmacology, Drugs for Alzheimer's and Parkinson's Disease. What is Alzheimer's disease? Alzheimer's disease is an incurable progressive neurologic disorder that destroys brain cells, which leads to gradual loss of intellectual abilities such as memory, extreme changes in personality and behavior. It is the most feared and most common form of dementia, which is a brain disorder that seriously affects a person's ability to perform activities of daily living, including loss of intellectual functions, thinking, remembering, and reasoning. Also, it occurs more commonly in older adults, currently the seventh leading cause of death among all diseases, one of the major causes of disability and dependency among older people globally. It involves physical, psychological, social, and economic impacts on people living with dementia and on their care providers, families, and society. A combination of factors has been proposed as the cause of AD and includes age, which is our greatest risk factor, genetics. Also, certain conditions may increase the risk, including Down syndrome. Also, increased risk by age 50 to 60 years, severe head injury or whiplash injury has an increased risk of developing dementia, smoking, high blood pressure, and high cholesterol levels. This table shows some symptoms of Alzheimer's disease. And the stages that we see, we have early, middle, and late. And in the early stage, some of the symptoms we see are forgetfulness, difficulty recalling events and activities, difficulty remembering names of familiar people and things, inability to solve simple math problems. In the middle stage, this is where we start to see beginning to have difficulty with speaking, understanding, reading, and writing, failure to recognize familiar people and places, forgetting how to perform simple tasks such as brushing teeth and combing hair, and inability to think clearly. In the late stage, we will see aggressiveness, anxiety, and need for total care and wandering away from home. How is AD diagnosed and treated? Diagnosis is made by excluding other possible causes such as thyroid problems, drug reactions, depression, brain tumors, blood vessel diseases. You will see brief cognitive assessment tools that will aid in the early identification of early and mild dementia, and those would be your mini mental state exam and, of course, the Montreal cognitive assessment. So for treatment, there is no cure for AD and no treatment can stop its progression. Drug therapy may, however, help prevent symptoms from becoming worse for a limited time, allow the patient to continue performing some ADLs for a longer period, and control some behavioral symptoms such as sleeplessness, agitation, wandering, anxiety, and depression. Now, you're going to need to have some priority actions to take before giving certain drugs. You want to make sure that you have a complete list of current drugs being used by the patient, including any over-the-counter medication, any herbal products. You want to also assess the patient for the baseline cognitive function, memory, attention, reasoning, language, and ability to perform simple tasks. Obtain a baseline weight, of course, baseline vital signs, heart rate and rhythm. And then, of course, we want to know We want the patient or caregiver to tell us about their usual urinary output, and we want a baseline hemoglobin and hematocrit level. Typically, we also want to know what the patients, if they have a need for medications to be crushed or given in liquid form. So it's very important to assess their swallowing. And this will also need to be continually assessed during the disease as it progresses. Of course, we do not want to crush time-release pills or open those time-release capsules. We also want to know baseline liver or kidney problems, anything that's going to affect the metabolism of the drugs. We also want to know if they've had any previous problems with gastric ulcers or GI bleeding. We are going to talk about Aduhelm, which is a biologic agent, and there are two types of drugs that we treat AD with. That's a biologic and a classic. So again, the biologic agent Aduhelm is an amyloid beta-directed monoclonal antibody. It is the first treatment that may prevent beta amyloid from clumping into plaques or remove the beta amyloid plaques that have formed to help the body clear the beta amyloid from the brain. Aduhelm is an IV infusion, and you can see this is the usual maintenance dose. IV infusions are given over 45 to 60 minutes every 4 weeks, at least 21 days apart. And you will see this is how we dose those infusions. So the intended response of biologic agents for AD, of course, this is to prevent beta amyloid clumping into plaques, removal of beta amyloid plaques, and have a decrease in cognitive and functional decline. The next group of drugs that we're going to talk about that we give for the treatment of AD is what we refer to as classic drugs. And the intended responses of classic drugs for AD is that dementia with AD decreases temporarily. Degradation of acetylcholine is inhibited, and progression of the disease symptoms is slowed. Also, we want to see that cognitive function in patients with AD is improved. And just keep in mind, we want to do certain things before we give those classic drugs. These are what we refer to as our priority actions. Obtain, of course, that complete list of drugs that the patient's currently using. And same as before, that's anything that's over the counter, any herbal products. Assess the patient for all those baseline conditions, baseline cognitive function, memory, attention, reasoning, language, and ability to perform simple tasks. You will see that we have classic drugs here on this table, and one of the most common ones that we see is the cholinesterase inhibitors. You will see Aricept. This is the usual maintenance dose. It's 5 milligrams orally at bedtime. We can increase that to 10 milligrams after 4 to 6 weeks. There's also transdermal dosage. That's just applying one patch. It delivers 5 milligrams a day. Topically to the back, of course, avoid the spine, and you will just change that once every 7 days. And this is approved for treatment of all stages. You will also see Razidone or Remenil. This is 4 milligrams orally twice daily with food. Increase at 4-week intervals to 12 milligrams twice daily. The extended release is 8 milligrams once daily in the morning with food. Increase at 4-week intervals to initial maintenance dose. Now, the other ones you can, of course, just read over. You have the glutamate regulators and the orexin receptor antagonists. So just review those and, of course, look at your initial dosage and then how we increase those. Common side effects of classic drugs for AD. The most common side effect of cholinesterase and acetylcholinesterase inhibitors are nausea, vomiting, diarrhea, stomach cramps, headaches, dizziness, fatigue, weakness, insomnia, and loss of appetite. You will also see side effects of suvorexant for insomnia include impaired alertness and motor coordination and worsening of depression and sleep behaviors. So keep that in mind. Any adverse effects would be abnormal heart rhythms such as bradycardia and atrial fibrillation. And although uncommon, all of these drugs can cause GI bleeding.